Hey folks, it's Matt Balcom here, currently on day 14 of a month-long Labrador wilderness canoe trip. And today, I thought I would take you through my first aid kit that I brought for this one. So when you're building a first aid kit for any kind of a trip, it's really important you go through a risk analysis specific to the trip that you're taking on. I'm not a medical professional, so this is just my interpretation of what I felt was necessary for this specific trip. If you're planning a trip for yourself, it's really important you do the same assessment and consult with experts where necessary to build a kit that works for your trip. So this is what I brought for a 30-day northern boreal canoe trip. So I'm going to get everything unpacked and then we'll go through each item. That's it. Okay, so where possible, I tried to compartmentalize the first aid kit so that if we needed something, I'd know exactly where it was and how to get to it quickly. So I'm going to run through everything that I packed and show you what we brought. So right on the top of the first aid kit, there's a couple of things just because they fit easily. One was just a wilderness first aid guide. So it's a nice small book, handy reference to have out here for all kinds of different ailments. And then the other thing was just this piece of foam. Makes a great, the intent is to have this as a pad for a splint if you have to make a splint, but it fits really nicely on top of the first aid kit and kind of protects some of the things that are inside. Another thing that was in here is sort of like a miniaturized first aid kit, which is great to have just for little day trips. A couple little band-aids, some medical tape, and a few Advil. That's all that's in there. The next bag is sort of the minor cuts, scrapes, and ailments bag. So this bag has everything from a whole assortment of different band-aids, small band-aids, big band-aids, knuckle band-aids, fingertip ones, a pair of scissors, disinfecting wipes, afterbite wipes, moleskin for blisters, all kinds of stuff like that. If you have like minor scrapes, that's the bag. This next bag is for more major trauma, so like really deep cuts, lacerations, that kind of thing. And in here we've got big rolls of gauze pads, we've got more medical tape, tensor wraps, triangle bandages, all kinds of different things, safety pins, and tons of bandaging. So this would be like if one of us were to slice ourselves with an axe or a saw and have a really major cut and major bleeding, we would just grab this bag and it would have everything that we would need. Another thing that I brought was a bag. There's probably 6 to 8 pairs of nitrile gloves, which is good if one of us does happen to get a major cut and the other guy needs to work on him. We can be, our hands get pretty dirty out here, so we can do it in a sanitary way to prevent infection. Just a little survival kit that came with another first aid kit that I bought, whistle, compass, but then the big thing is there's some water treatment tablets in there. So if our filter failed for whatever reason or we didn't have it, we could purify water with those. Got an emergency blanket for hypothermia treatment and also a few hand warmers if we ever needed them. The next thing is I brought kind of an assortment of ointments. So the first one, 30-day canoe trip, is Rub A535. Great for sore muscles.
We could use that yesterday.
Yeah, probably should have used it. Another one, this is clotrimazole, and that is an antifungal ointment, which is great if you're, we swim as much as we can out here, but if things start to get a little funky, and having a little bit of an antifungal ointment to treat those kinds of things is really great. We have your typical sort of polysporin antibacterial ointment, great for, again, like minor cuts and scrapes, keeping things clean and preventing infection. Got some hydrocortisone cream. That's like just a great cream for different kinds of rashes or skin irritations. And then on to medications. So we brought an assortment, acetaminophen or Tylenol. There's one small thing of Tylenol. Another small bottle of aspirin. Slightly larger bottle of ibuprofen or Advil, which is great for muscle aches and headaches and things like that. Brought a small package of Benadryl, which you don't have to use it often, but if you need it, it's super handy for if somebody's having an allergic reaction, weird fly bites, bee stings, anything like that. It's really nice to have some Benadryl on hand. Another thing we brought is diarrhea relief medication, just in case. Not something we would want to actually use if we had, say, Giardia, because you actually want to clear that out of your system. But if we did have some kind of infection to the point where dehydration was becoming a concern, these could be useful. Couple of packs of Tums just for heartburn relief. And then we get into the prescription stuff. So we before we left on this trip, we actually went to the doctor and got a few prescription medications just in case. So the first one is this one's a cephalexin, which is just like a general antibiotic for an infected cut, infected tooth, ear infection, anything like that. We could pop this stuff and it would clear it up. The next one we got is called metronidazole, and that's specific for like a stomach bug like Giardia. A regular antibiotic is not going to be effective against Giardia. You need a specific type of medication, so that's what this is. And I think the last thing in here was just some medicated eardrops for potential ear infections. We're swimming in lakes trying to keep clean, and you never know if something might get in there and cause an infection, so it's a nice thing to have, and it's small. Okay, so that's basically it. That is everything that I packed for a 30-day wilderness canoe trip. Before you go out on your next trip, make sure you conduct your own risk assessment and pack a first aid kit that will help you address any of the situations that you might face specific to your situation. Stay safe out there.